Welcome to today's Talking Tinnitus podcast. We're here with special guest Dr. Craig Kasper, returning to the show. Craig is a qualified audiologist. He holds a doctorate of audiology from the University of Florida. He's the owner of New York Hearing Doctors, and he was elected as a distinguished fellow to the National Academies of Practice. So welcome back to the show, Craig. It's great to have you.
Great to be here again. Thanks, Neil.
So today's topic is how important is hearing protection? And I'm going to assume that it's very important, but how important is it for people with tinnitus? Either maybe to prevent or to manage, as they go about their daily life, as they live with the condition.
Well, I think hearing protection is a really important topic because when we take a look at hearing loss, the number one preventable cause of hearing loss is noise exposure.
Sure.
And noise exposure can happen at any point during the course of our days and lives, whether it's occupational exposure or recreational exposure. So some of us might have loud, noisy jobs. Most of us like to go to concerts, and it's really important that we consider how we will protect our hearing in those environments. I equated years ago, the dermatology community did a great job at helping everybody understand the impact of sun exposure on our skin as it results in skin cancer.
Sure.
Now, hearing loss is not life-threatening necessarily, but it is life-altering.
Of course.
So we have tried, and I think we continue to do a decent job at educating the general public of the importance of wearing hearing protection. Because again, hearing loss from noise exposure is the number one preventable cause of hearing loss.
Yeah.
So it's all in our hands.
So, prevention can sometimes be better than treatment, right? So
Right.
Make sure you do your best up front, I suppose. I would be curious whether or not, would there be any maybe distinction in the types of hearing protection you might recommend to somebody who doesn't have tinnitus and somebody who does have tinnitus? Is that something that's to be considered, or is it generally just hearing protection is good?
Well, hearing protection comes in many different forms.
Sure.
It can come in the form of a generic foam over-the-counter plug.
Yep.
And there can be custom filtered plugs. And it really depends on the environment that somebody might be exposed to. So for instance, if you're working with power tools, a generic fit plug is perfect. If you go into concerts and you want to be able to hear the music clearly, chances are you'll want to invest in a custom filtered earplug, of which you can speak to your audiologist about that. From a tinnitus perspective, I think the most important thing to understand is the parallel symptom of sound sensitivity, because ultimately we do not want to overprotect our hearing.
Okay.
So hearing protection is great, but when we have sound sensitivity, overprotecting our ears can actually make us even more sensitive.
Okay.
And this is something that seems a little contradictory in terms. Of course, a patient might have a little bit of sound sensitivity. They feel that it might actually exacerbate their symptom of tinnitus, which is likely due to some anxiety or stress because they fear that they're doing some damage to their auditory system. But in essence, what they're doing is they're typically overprotecting, which then makes them more sensitive to sound.
Okay.
It's sort of like wearing sunglasses all the time, even when you don't need to wear them.
Okay.
And that one day you go out in the sun and you take off the glasses and
You're like, oh my God. Yeah.
That's exactly what happens to our auditory system, is we literally sensitize our system if we overprotect.
Understood. So I suppose a qualified professional can help you make a good choice there to kind of avoid that unintended consequence, I suppose. Is that a fair statement?
Really important for a qualified hearing healthcare provider, audiologist who is preferably a tinnitus specialist, to conduct some testing to look at sound sensitivity issues, to see if hearing protection really is necessary in certain situations, to kind of keep you more comfortable. Again, I would totally not recommend wearing hearing protection all the time, but your qualified hearing healthcare professional will be able to tell you what type of hearing protection would be appropriate for what environments, or not.
Yeah. So whether it's a high noise exposure profession, if they're musicians, going to concerts, stuff like that. Okay.
Correct.
Super. Well, thanks for your time. So hearing protection is important. And again, I think the message we typically leave people with is go and find a qualified professional who knows this stuff, and they'll be able to get you on the right path for your experience with tinnitus and noise exposure in this case. So thanks for your time, Craig. Thanks for joining the show.
My pleasure. Thanks again.